So to begin this recording, my assignment, I decided to choose Long Island Jewish Forest Hills Hospital. The reason why I chose this location was because it's a hospital that I'm very familiar with, as well as it's a hospital that my organization, where I currently work at, works really close with Long Island Jewish Forest Hills community and the hospital in order to provide cancer services as well as hematology services. So these are one of the reasons why I chose Long Island Jewish Forest Hills Hospital. Okay, so to begin, the mission of this organization is to be better tomorrow than we are today. As this hospital is part of Northwell and the division of Long Island Jewish Medical Center, this organization strives to improve the health of communities they serve, and they're committed to providing the highest quality clinical care, educating the current and future generation of healthcare professionals, searching for new advances in medicine through biomedical research, promoting health education, and caring for the entire community regardless of pay. This is stated to be this entity's mission and vision. So for the hospital's geographical catchment area of the entity, the hospital is located at 102-01 66th Road, Forest Hills, New York, 11375. It serves the community of Queens as well as Forest Hills. So, and next for the target population, this organization is the only hospital in Forest Hills, New York. It serves the community of Queens. It provides and targets patients of all ages because of its emergency and specialty services it provides. In addition, the organization provides services related to inpatient medical and surgical care, intensive care, women's health services. The hospital is designated as a level 2 prenatal center. In addition, the organization is an emergency department 911 receiving site, a certified heart station, as well as a New York State designated stroke center. Its services include bariatric surgery, cardiology, gastroenterology, general medicine, general surgery, imaging, orthopedic surgery, urology, and women's health. This organization also offers a well-regarded medical residency education program and a podiatry residency education program. Through specialty and emergency services provided, it attracts and targets patients who require inpatient medical or surgical care, intensive care, and women's health services. It also targets the medical residency population as this organization promotes, supports, and also encourages educational programs related to healthcare and medicine. For example, I know that Northwell puts a lot of immense amount of resources on education programs in order to help doctors, help administrators to further education, and even help support them with any programs and any financial assistance they might need, revolving around furthering medical education. So the next slide would be services provided. These are the services provided, like I said before. Because of these services provided, they target such a large range of diverse population. In addition, because Queens is one of the most diverse places in the world, it has to consider what kind of services are needed within those diverse communities, as well as if these services are prepared for the patients in order to attract them as well as increase their patient base. So the primary revenue source of this organization comes from the mixture of governmental and commercial insurance. An organization must have a balanced governmental and commercial revenue. If it is too much one-sided, it can mess up their balance sheets as well as their revenue source. So it's really good to have a balance of commercial payers as well as governmental payers such as Medicaid and Medicare. The organization provides healthcare services to a diverse population, as Queens, New York is one of the most diverse places in the world, as mentioned before. It also has a very diverse mixture of revenue due to this reason, because patients are coming from low income, high income, middle middle class, and it's so diverse in Queens where we don't have just one majority. It's like spread out. And because of that reason, patients would have Medicaid, commercial insurance, as well as Medicare. The organization accepts a wide range of insurances such as Medicare, Medicaid, sliding fee scale, as well as commercial insurance. This gives the organization to get paid from multiple payers, as well as it gives more accessibility to the patients because it doesn't shy away from any one insurance, that it accepts any kind of insurance that patient has. And if patient does not have insurance, emergency Medicaid can also be provided for people who qualify in terms of financially. The organization also get fiscal funds from the government, as well as the patient from the government, because of its value to its community, and as well as Northwell Health, because it's part of a large healthcare network, which Northwell Health provides also funding to the hospital in order to provide care for the patients in its community. So some other risk factors and factors to consider within this facility would be personal information. Hospital organizations are constantly at risk of violating confidentiality policies and HIPAA policies related to patient personal information, because the organization handles and deals with such large volumes of patient data. It's more at risk than such as a smaller doctor's office to because there's less information for them to collect and handle. So that's why in a bigger hospital setting, they're more at risk to make mistakes and violations due to these reasons. Secondly, is biological and chemical. The organizations work with chemicals and medications every day that are, if used incorrectly, may harm or endanger patients. This would be a biological or chemical risk that may affect patients and its community. Any hospital, any medical facility, this is a risk within its facility, because mistakes do happen, and if used incorrectly, this may danger the population, the community the hospital serves, as well as its reputation, as well as their ability to provide services for these individuals. Third would be demographic. As mentioned before, the area of Queens is a very diverse area, and because of that, it has to account for gender, age, culture, as well as the aging population in the community. Because as this organization provides care to the underserved areas of Queens, it has to be aware of and acknowledge social determinants of health, especially in a diverse area such as Queens, where you have middle to low income families who lives are being affected due to social determinants of health, and this is factors to consider when looking at possible risk drivers and factors in the facility. As this risk relates to the target population, the hospital served also affects the revenue of the organization, as well as the health outcomes of the patients. So the social determinants of health, such as income and religion, should also be considered when determining risk drivers and factors for the facility. Third would be environmental and behavioral. Environmental is because of the location, because they're coming from such a different culture. There's so many mixture of different illnesses as well as cultures. Patients would the organizations would have to understand and try to understand what kind of community they're serving and the demographics that are involved. Behavioral also includes because patients' behavior and the influences we have affect their patient or health outcomes. So I feel like these are the most crucial risk drivers and factors to consider when thinking about risks. So in terms of describing potential areas of impact due to exposure include the community of Queens and New York. In addition, the biggest impact will be on the community of Forest Hills. As this organization is the only hospital in the community, even if an event of exposure were to happen, patients requiring service from the community, as well as other emergency services required from different hospitals, patients will be impacted in a negative way. Furthermore, other areas related to Northwell Health will also be impacted because this hospital organization is part of Northwell Health and it represents it. Any risk incident event that happens within this organization, Northwell as well as the community will be affected as a whole. Some risk categories for this organizations include the demographical and environmental behavior risk of these factors. The risk rating, environmental and demographics are considered high risk. Patient information is considered high risk, and behavior risk is also considered medium risk. According to the chart, levels of severity of consequences, by doing the formula for risk rating, it turns out that environmental and demographic risks are 48, which considered a high risk. Patient information risk is considered 21. This is still considered high. And behavior risk is considered 16, and this is considered a medium risk. These risks will ultimately have an impact on patient safety, organization image, quality of care, population health, and employee performance. Demographics such as the aging population, as well as social determinants of health, is especially important for this organization that serves a diverse community. It's important because the organization has to take into account all these different methods of communication, culture, and health. These risk factors would include smoking or eating unhealthy food is considered a behavioral risk. As the patient is consuming unhealthy and dangerous chemicals and food, it puts the patient at risk of getting sick or ill. As a result, this also puts the facility at risk because the organization has to also consider population health when providing these services. Personal information, another risk driver, as this organization handles and works with large volumes of patient and patient data, they are more at risk of violating HIPAA and Privacy Acts than smaller organizations. These are the types of reasons that risk ratings are really important in these cases, because it identifies which ones are the most important in terms of priority, because you would obviously handle the ones with high risk and then put a little less concern into the medium risk, because high risks are the ones that are need to be handled as soon as possible. So the action steps. Some action steps would include goals and objectives, focus on risk factors. These factors and goals, these objectives and goals are needed in especially a goal-oriented and constantly changing environment, because as healthcare is constantly evolving in the environments and in terms of the population that we serve, goals and objectives are you need them because it helps the employees strive to be better, as well as organizations have a quota to meet, something to drive them towards completing a goal or reducing the risk. Another action step would be additional support systems. Oftentimes, there are employees or even organizations that are lacking in support systems because they're so concentrated and focus on daily operations that sometimes they need additional support systems to help with their daily operations as well as patient outreach. Although the organization cannot stop the aging population from aging, it can help make efforts to delay it as much as possible, and I feel like these are some ways to do that. Another action step would be to include training of staff, maybe annual staff training or monthly. Through training and education, employees will be prepared and knowledgeable in patient privacy, as well as increasing performance or ways to increase performance. These are some action steps I would take in order to reduce the risk while improving performance and population health for the community that this hospital serves. And these are my references. Thank you.